Okay, I have 2:02 on my end, so I'm going to kick us off. You'll note that we recorded the beginning of the roundtable just to make things a little bit easier, but we will still be doing an open Q&A at the end over audio and also via chat. So please submit any questions you have via the chat. All right, let's get started. Hello all, and welcome to the June Atlas Provider Roundtable. We are very excited to have you with us today. So for today, here's a look at what we'll be covering on the roundtable. We'll start with an update on website traffic to the Atlas site, treatmentatlas.org. We'll give a bit of update on the new states that we'll be coming to. You probably saw our announcement. We'll share a few of the key dates for data collection for the survey collection. We'll share current survey participation rates, both nationally and within our states. Talk a bit about upcoming activities, including information about how we can support you with the patient experience survey. And then we'll do time for Q&A. And just to note that we have some additional slides in the appendix if you need any help, any additional information. So getting started with an update on the Atlas website traffic. Just to note that since we launched last July, we have had over 106,000 sessions, and you can see how this breaks down below. So we've had a relatively good sessions by state, and we're certainly excited. We've started a new media campaign that we're hoping will really help to bring the website to even more people who could benefit from it. Talking about website visits, we wanted to thank those of you on the call for really helping us make the pilot and the Atlas website possible. As a reminder, the Atlas pilot was in 6 states, with Delaware, Louisiana, Massachusetts, New York, North Carolina, and West Virginia. And we started with an initial $5 million in funding from philanthropic sources and payers. As you recall, we developed our quality measures. They were pressure tested by an NQF panel. We launched our state advisory committees. We gathered and analyzed data, did technical assistance, and then also launched the website. So that's kind of looking back. We're very excited to announce that we'll be expanding to 4 additional states in 2021. So as you can see here, we have New Jersey, Pennsylvania, Florida, and Oklahoma. So if you have facilities in those states, or colleagues who work in those states, we certainly welcome you telling them and let us know if there are any questions, as always. And just to note that we have more states on the horizon. And so we're excited to see this map get a lot more colorful over the coming months. So with all that being said, wanted to quickly remind you all that it's your chance to respond to the Atlas survey. So you should have received probably multiple times at this point, emails from us with a link to the 2021 treatment facility survey. A reminder that the deadline to submit that survey is July 30th, so just a month and a half from now. And you must complete and attest your responses online. We won't accept any paper or PDF surveys. You might see a reference copy of the survey included in the emails. This is not where you submit your responses. Please submit them at the link. And as a reminder, any out-of-date information will be retired from the website this November. So what we mean by that is that if you don't submit the 2021 survey, even if you submitted last year, your Atlas website profile will be incomplete. So it will show only your facility name, address, and phone number. There won't be any more information about your facility, though patients and family members will still be able to leave their feedback. So just a reminder, even if you submitted last year, you need to submit again this year in order to keep the information up to date. And as I mentioned, our appendix has some key tips for completing the survey. And if you have any questions or issues, feel free to submit a ticket at the Atlas Help Desk. I can promise you it is real people who respond to it, and we are more than happy to help. And so with that in mind, here's what we're seeing on the state level. And I'll note that these are current as of Friday, June, the 11th. We had 2 responses in Delaware, 15 in Massachusetts, 55 in New York, and 10 in West Virginia. And we've seen these numbers grow a little bit over the past few days, but it's a relatively steady trajectory. And so we certainly encourage you to complete and submit your survey. And to get a little more in detail, I'll hand it over to Angad Buttar to go through some of the regional response rates.
Thank you so much, Carolyn. So here in Delaware, we can see the regional response rate by county. So 3% in Newcastle, 0 in Kent, and about 6% in Sussex County. In Delaware, we have been working with our DCM partners to keep them updated on response rates by facility. We've also been reaching out to providers in Delaware to see if we can help answer any questions as well. So as we continue to work with Delaware, we sort of hope and expect that the survey rates will steadily increase. Next slide, please. So in Massachusetts, here you can see the rates by region. So 3% in our first, second, and third region, 2% and 4%, I'm sorry, 3% in our fourth region, and still waiting on our surveys in the region 6. In Massachusetts, we've been working with our regional managers to provide them with the response rate so far. We've also attended provider meetings to really help answer questions that providers might have as it relates to the survey. As there's been new leadership at some of the facilities, we've also conducted some Atlas webinars so individuals can really see the full functionality and capability of the platform as well. Next slide, please. So in West Virginia, we've been working very closely with the Office of Drug Control Policy. They sent out a newsletter in which they were reminding providers about the survey. We're seeing some good response rate by some of our regions, kind of on par with where we were the last time we conducted our treatment facility survey. Having said that, we're looking to sort of increase the process as well. We're also working with our provider associations in West Virginia to help see if they have any questions that they're receiving from providers as well. So again, look forward to seeing these response rates increase over the next few weeks here as well. Next slide, please. Thank you. Now I'll turn it over to my colleague, Leah Kaufman, to talk about New York.
Thank you, Angad. So New York, we're looking pretty good so far. As you can see in Western New York, we have an 8% participation rate. Likewise, in Long Island, we're at 14%. Central New York is at 10%. Those 3 regions performed really well in terms of survey participation last year. Finger Lakes is a little bit behind where we were last year, so 7% there. And then we're definitely focused on getting participation up in Western New York and the Mid-Hudson Valley. So obviously, if you're in any of those areas and you haven't done your surveys yet, we'd love to get you to complete those. And then finally, I didn't mention New York City, which is at 6%, also a little behind where we were last year. And at this point, as you are probably aware, and as Carolyn shared, we're having reminders sent out on a regular basis. So you've probably seen recently reminders from ASAP and Greater New York Hospital Association. So please just take the time to do the survey if you haven't yet. Last year, we had a 75% participation rate in New York, and we're hoping to exceed that this year. So let us know if you have any questions. My email's on the slide.
Great, thank you so much, Leah and Angad. And just to reiterate, you'll be seeing a lot of messages from us in the coming days and from our partners encouraging you to submit the survey. So as a note, this is our second to last provider roundtable of the summer. Our next one will be on Wednesday, July 14th. And that roundtable will include our normal updates, as well as some information about the new portals that we'll be launching. So you'll get to see where your data go on the back end, as well as a little bit about the patient experience survey. For August through October, we don't have any events currently scheduled. We figure you all might want to break in there, but certainly we'll still be available via email and we'll still be sharing updates. And then in November, as we near the website update, we may have another event then. Also notice that we may be putting out an announcement this July. It'll be the 1-year anniversary of Atlas launch. So keep your eyes peeled for something then. If you want to view our last roundtable session, it's available on YouTube, as this one will be. As I mentioned in the agenda in a little bit here, we're looking forward to next month really giving providers a lot of support tools to help collect that patient experience feedback. And so as a reminder, the patient experience is a multiple choice and one open text question survey that patients or family members acting as proxy can fill out at any point during treatment. It's completely anonymous, and a facility must receive at least 20 responses in order for those reviews to be displayed on the Atlas website. So your facility may have, for instance, 3 responses, but those won't show up yet. To support facilities, because we know that this is, it does require a bit of effort, we will be rolling out a toolkit, a patient experience toolkit in July and August, which includes lots of materials designed to make it easier to get your patients to respond. And again, once you do have 20 responses in a facility, you can view those responses either on your profile page on the public-facing Atlas website or in your password-protected portal. And also, coming down the pike in July, we'll be adding the ability to search by facility name. So as you know, up until now, the only way to search has been by location, but this will make it even easier for patients to find your facility online. And I'll note that we have our continuous quality improvement series that's going on. We just had a session a few weeks ago about kind of with Niatex, with Todd Mulfenter from Niatex and Lisa Blanchard from Spectrum. We're excited about our next session, which will feature a provider panel moderated by Victor Capocha. So if you'll remember the first session last year, this is the same facilitator, but now he's back with 3 of our providers to go really in depth in terms of what providers are doing for quality improvement tangibly at their facilities. And as a reminder, we welcome addiction treatment providers, state partner agencies, commercial payers, and more to join the discussion. And all sessions are recorded and there's no cost to attendees. And if you have any questions, you can visit treatmentatlas.org/CQI for more information. Just a quick refresher on the project timeline for context. As you can see now, we're right in the midst of providers sending in the Atlas survey. From August through October, we will be doing data analysis, and we'll also have that provider preview period. For those of you who were with us last year, you'll remember that that's a time when you can review what your data will look like when they display on the Atlas website. And that's a time where you can correct if there are any transmission errors. And so what I mean by that is, if you said one thing on the survey, but something else popped up on the website, you can let us know at that time and correct that. And after the provider preview period, we'll do any updates or corrections. And then this November, the updated profiles will go live in Delaware, Massachusetts, New York, and West Virginia. And at that time, we'll also be giving you promotional materials so that you can help patients know about your facility. Just as a reminder, in case you didn't hear it enough, we really want you and encourage you to submit your survey. The deadline is Friday, July 30th, so a little over a month and a half from now. And by submitting your data, you really ensure that your facility's profile on treatmentatlas.org will be complete. This means that your facility will automatically be included in relevant searches. So right now, if your facility's profile is incomplete, you are filtered out of many searches because of the lack of data. Your information will help tens of thousands of visitors to the website. And as I mentioned, you'll have access to free promotional materials from Atlas, so you can really show yourself off as a facility committed to quality and transparency. Again, if the primary contact or any of the contacts at your facility have not received their link to the Atlas survey, please contact us at the help desk, and that link is clickable. Or you can also email us at atlas@Shatterproof, and we will help navigate you. For those of you who have almost finished your survey or have just finished it, or are in the process but are getting ready to finish it, we would love if you could help spread the word. So we have a few blurbs here, and this not only allows you to have more to benchmark to, but also just really helps us move forward the quality of the field. So you can see here some sample tweets / LinkedIn posts that you can use. And with that, and if you have any questions, you can check out treatmentatlas.org, and you can always contact the Atlas Help Desk. And for any other questions, reach out to your state engagement director. So for Delaware, Massachusetts, and West Virginia, that's Angad. For Louisiana and New York, that's Leah. And for North Carolina, that's myself. And we will be distributing the slides and recording after the webinar. And so you don't need to be writing any of this information down except that July 30th date. Otherwise, we will turn it over to questions. I am muted and I was talking to myself. Hello all, for those of you who just joined us, we just finished the presentation portion of our webinar and we would love to turn it over to any questions you may have. Feel free to unmute yourself. I see a lot of familiar faces, or drop them in the chat. So Lisa, I will start with you as you are unmuted. So I'm assuming you have something to say.
Too. I did submit a help ticket and I got the help ticket response back, but I don't, maybe it went to like beyond the clutter folder and like some other universe, but I haven't heard anything back. So we're working with a single source survey because we have so many surveys in Massachusetts here at Spectrum. And so I am completing the single source survey. I just want to make sure before I like review and submit like my part that when I put in my name and attest to like I did the single source survey, right? That when I click like next to submit, that then it goes to like the program directors and then they get the chance to make any edits to that and add in like the staffing detail and the stuff that, you know, can't go to every site.
Exactly, that's exactly it. So for those of you on the call with fewer than 6 sites, you didn't hear about this, but for our large facilities, we gave the option to submit a single source survey. Once that's submitted, all of that information goes to the sites, and exactly to your point, Lisa, those site directors will get an email. If you complete before 10 a.m., they'll get the email at 10 a.m. the next day. If you complete after 10 a.m., they'll get the email 2 days from now with their link to their survey. And exactly to your point, they need to fill out the rest of the information, and then either they or you again would need to attest to that specific survey, and you can download the responses as a PDF and check them, etc.
Okay, perfect. All right. Just wanted to make sure before I click submit that would be the next step. I have it all filled out and ready to like send out. I just wanted to be sure. Okay, thank you.
Thank you. Yes, and please feel free to call me because I know that we want to make sure that you get the survey done.
Yeah.
So thanks for checking.
Thanks.
And Brandy, I see that you're unmuted. Do you have a question as well?
I do, yeah. So I've emailed you a couple times, Caroline. Nice to see you. I'm kind of transitioning and taking over my colleague's role, Paige. And so we participated last year. We're updating our surveys. I did the source survey. I have the programs now. So my question, I apologize if you already answered this, but we had people who did the surveys, the patients did, but we didn't necessarily get to 20. So is it, you're going to build upon the ones already submitted, or is this a fresh new 20?
Great question. So this is something that we are discussing internally as well. So we're kind of trying to strike a balance between making sure there's not too old of information, but also making sure the facilities do have the 20. So right now, what we're looking at is that patient experience feedback that's more than 18 months old, we would retire it. I will note that we have not confirmed this yet. So don't think that, in 2 days, all of your patient reviews will go away. We're still working out what the timing will look like. At that time, it wouldn't be that like every single review would go away. Instead, it would be any that are 18 months or older would go away, but any that are younger than that wouldn't. Again, we're still working out what this might look like. It might be that we flag reviews that are older than 20 months to say, or older than 18 to say this is older than 18, but that way you don't have all the reviews go away. We're still sort of trying to figure it out exactly to your point so that you don't have to start over again. Okay. And Leah, I was gonna say, Leah, do you have anything to add to that?
No, Carolyn, that was really thorough. I just wanted to say hi to Brandy. Brandy, we met in person once in the before times, so it's good to see you.
COVID, yeah.
Yeah, let me know if you need anything else. Feel free to email me directly.
Okay.
Good to see you on. And you have to have that in by Friday.
The source survey.
The source survey I already did. Now I have the
Okay.
program ones were already submitted to me, and that's July 30th.
Yes.
Okay, I was
Yeah,
gonna say,
perfect.
Leah, don't freak me out.
Sorry about that. Nope, you're good then.
Okay.
Any other questions? All right.
Well, if there are no questions, please feel free to hop off. Leah, Angad, and I will stay on the line if you want to talk to us one-on-one, but otherwise you can reach us at our email addresses. We will send out the recording and slides with all that info, and we are really more than happy to help in terms of completing the survey, whether it's an email, whether it's a phone call, whether it's we get on Zoom together and walk you through. Let us know.
Thanks, everyone. We'll see you next month.